And speaking of bone growth, we move on to another piece of evidence. The third clinical evidence is exostosis mandibular and maxillary. Folks, bone growth means compression, stimulation, and differentiation of blasts and clasts. We have here compression leads to bone formation. And often this is related to centric or tonic bruxism. There are two types of movement. Non-rhythmic, that is centric, tonic, the patient clenches, and rhythmic, the patient grinds. Okay, so is the patient coming to you like this? Write it down in these comments here for me. Note what I'm saying and write it here for me. Is the patient coming like this, Andre? I have seen it increasing more. And we have then associated this ecclestosis, the bruxism, that in this patient's case also had a fracture of the incisal edge. Look how interesting. So we have to investigate why. I am going to perform, for example, the surgery on this patient who came complaining about the volume of the torus, the volume of the exostosis maxillary. We call it maxillary etocystosis. This growth volume, it was bothering her here. Then I would perform surgery. If I perform the surgery on this bone growth without the differential diagnosis of bruxism, it will return. And the patient will again need the therapeutic approach. It needs to be accompanied surgically. It needs to be accompanied by a differential diagnosis. It needs to be accompanied by a real treatment for bruxism. So note that exostosis is related to compression and differentiation of vallus, clast, bone formation. So if you want to know more about these topics, start following me and share with more dentists.